Good morning, everyone. Breaking news here in the Allison Morrow studios. How's everybody doing today? It looks like we have a bunch of people in the chat already, so thanks for tuning in. It's kind of like a last-minute live stream. I got Lynn taking care of my producer. As you all know, my producer, 11 months old, so now able to cause even more problems than before, so try to keep her away from the keypad. Anyway, today, we're going to talk about how the CDC and FDA have released a statement on the Johnson & Johnson vaccine. They're calling for a pause to it. We'll talk about a bunch of other stuff. I was able to get a medical doctor for this, but not to be the Chris Cuomo of YouTube. It is my father. I'm going to bring him in. Here we go. Let's see. All right. Hey, Dad. How's it going?
Morning.
Good. In sunny Florida. And it is not easy to find a doctor willing to go live on YouTube at 6 o'clock in the morning Pacific time. So I'm thankful that, well, it's 9 a.m. It was 9 a.m. for you when I texted you, but you are an orthopedic surgeon and you can talk about blood clots and whatnot. That's what we're going to delve into today, because it looks like this is something that they're looking into. And I guess what I'm going to do first is bring up, this is the CDC and FDA statement, and I'll just read the beginning of it real fast. As of April 12th, more than 6.8 million doses of the Johnson & Johnson vaccine have been administered in the U.S. CDC and FDA are now reviewing data involving 6 reported U.S. cases of a rare and severe type of blood clot in individuals after receiving the J&J vaccine. In this case, is a type of blood clot called cerebral venous sinus thrombosis was seen in combination with low levels of blood platelets, thrombocytopenia. All 6 cases occurred among women between the ages of 18 and 48, and symptoms occurred 6 to 13 days after vaccination. Treatment of this specific type of blood clot is different from the treatment that might typically be administered. Usually, an anticoagulant drug called heparin is used to treat blood clots. In this setting, administration of heparin may be dangerous, and alternative treatments need to be given. So it says they're also recommending a pause in the use of the vaccine out of an abundance of caution, and that is important to ensure the healthcare provider community is aware of the potential for these adverse events and can plan for proper recognition and management. And I think I saw somewhere that they're, like, if there are federal sites, they're going to be specifically stopping them. I believe I saw, for now, I believe I saw somewhere that they're going to, it's at sites that are federal sites, that they're going to stop it for now. So anyway, I guess the first thing, maybe, could you just explain the blood clot issue exactly? Like why are they saying it's different from another kind of blood clot, and what exactly does it do to a person? Why is it a danger?
Sure. We don't know exactly what the blood clot is in the Pfizer vaccine. The FDA put out a Twitter just saying that there were blood clots, but it's very likely similar to the AstraZeneca vaccine. In fact, the European Medical Agency reported, I think they summed up their data February 28th, and they reported on blood clots not only in the AstraZeneca vaccine, but the Pfizer vaccine. So very likely this is that same story that's ongoing. This is nothing new. It's new to the United States news, but not new to Europe. The blood clots are cerebral venous sinus thrombosis, which means your blood draining from your brain can't drain out because the sinus or the big vein pool in the brain is blocked by the clot. And so then that causes hemorrhage, because now the blood can't flow out of the brain. The brain is very sensitive and it's like mayonnaise. It's very easy for things to blow up in the brain. So the hemorrhage ensues next at a low pressure and often causes fatalities. The other blood clots in the spleen, the splenic vein, which can cause abdominal pain, and it could potentially infarct or kill the spleen, causing an abdominal emergency. So the blood clots are not your usual, I got a blood clot in my leg, I need to wear stockings. These are often fatal blood clots. So they're very, very serious. Low incidence, the reports in Europe were to the Pfizer and the AstraZeneca about similar, about 1 in 350,000 people, but fatal. And although low incidence, the majority are occurring in either children or young adults, which is a group that's very low risk for a problem with COVID. So that sums up the blood clot.
Okay, thank you for that. So I was gonna show everybody, let's see if this will work again, if I can bring this up here. This is an article from Science magazine. Hard choices emerge as link between AstraZeneca vaccine and rare clotting disorder becomes clearer. So this is the vaccine that they're basically, at least in Europe, they're willing to say a probable causal association, whereas the other ones, it still seems like there's like, could be, might be, we don't know. It's an abundance of caution. That this one they're willing to come out and say, okay, it's sounding more and more like this could be a causal relationship. It says in Europe, at least 222 suspected cases have been reported among 34 million people who have received their first dose of the vaccine. More than 30 have died. And I'm curious, when it comes to, maybe you could talk a little bit about how this process of cause versus, there could be a link, like how did doctors and scientists work through the process of deciding, is this in fact caused by it? Is there something that's happening that this has relationship to, but it may not be a direct cause? Just so people maybe understand a little bit more about how that process works. Would you mind running us through that a little bit?
Sure. As a doctor, when I read a science study from a journal, I look for, is it a prospective study? Is it a retrospective study? Because the prospective studies, especially those with a placebo, have much more weight. And then the second thing to look for to decide if there's a causal relationship is statistical probability. So statistics are done in a good study that will tell you there's a 95% probability that there's a connection, or there's a 99% probability. Anything less than 95% is usually looked at skeptically, and anything less than 90% is not usually considered. So there's a 95% probability or more. Most scientists would say there's a likely causal relationship, say, between the vaccine and the blood clots. I haven't seen any statistics in the few places that I've looked. All I've seen is that initially the European Medical Agency said there was no link, and then they retracted that a few weeks later and said there may be a link. And then some AstraZeneca researchers believe there is a link. In fact, they're even giving a name to it. They're calling it vaccine-induced prothrombotic immune thrombocytopenia. So it looks to me like there's a link, but what we're waiting for as scientists is a retrospective study that shows statistical probability.
Okay. That's helpful. I'm trying to work out some audio issues on my end, but I think we're gonna have to roll with it. It's live TV. So I was in and out of what you were saying while you were talking about that, trying to figure out why I can't hear you through my earpiece and I can hear you through the screen. But Dad, you were watching me 12 years in TV news with lots of malfunction. So anyway, we're gonna get through this. But everything you said, I think I think there are some questions that people have, so I'm going to go through real fast and see if there's anything that might be of interest that you can answer. So Andy asks, I wonder if blood type is a factor, RH status or otherwise. Any thoughts on that?
I know very little about the connection. I know O negative people apparently are more protected, but I don't know much about that. You do have more antibodies if you're a different blood type. So maybe there's some connection. It certainly seems to be a connection with the immune system. But I don't know the direct thing. A lot of people have come to me, friends, and said, "Hey, I'm O negative. I guess I'm safe." And I haven't seen the science that's statistically proven. So to me right now, that's more rumor than it is proof. Now I can't hear you.
I keep unmuting. I keep muting myself because I can't get my earpiece to work. Anyway, I did have this MedPage article up, but now it's making me have a login, so I'm not going to do it. It looks like they're looking for why you would have a vaccine that would have this kind of effect. And I'm sorry if I missed it because of the audio stuff. Did you talk at all about, what are some side effects that do come with vaccines, that this seems to be not a common reaction? What is more common? And it seems, is there anything that we can look at to say, like, okay, maybe we can understand why this would be attacking the blood? I do remember back very early on in the COVID, like basically this time last year, or maybe even earlier, where there was a lot of discussion about whether this was a blood disease or a respiratory disease, because remember, people would have low oxygen levels and they were having trouble breathing. And the question was, is this an issue of the blood binding to oxygen, like your hemoglobin and maybe I'm totally botching this, but I just remember the question being asked, and really specifically because the ventilators were not working. Is this really a problem of people not having the ability to breathe, or is it a problem of the blood binding to oxygen? And I'm just curious about your thoughts on that. Maybe that's a little bit outside of your wheelhouse, but maybe we could do both things. Talk about, like, what are the more common reactions, I guess, because you and I talked about this off camera with these inflammatory reactions. But then also, why would we maybe see a link to blood and heart stuff?
That's a really good question. Really good question. Because here we have blood clots, and at the same time, you have patients who are hypoxic when they present with COVID. Are the two connected? I haven't heard or seen anything. Could I somehow physiologically make a connection? It has something to do with an inflammatory response somehow, to me. Blood clots, thrombophlebitis, itis means inflammation. And so there must be some inflammatory response, perhaps to the red cells. A doctor I listened to recently, an expert immunologist, I sent you his name. He's from Yardley, Pennsylvania. He said that this virus selectively attacks heart tissue and neural tissue. Our body is so complex. There are so many different ways that you can lower your blood oxygen, all the way from the sensors in your body to your lungs, to your red blood cells, and I'm sure a few other things that we don't know. So right now, it's not known exactly how the virus causes this hypoxia, but the COVID, which is the disease, that for sure is caused by inflammation and overreaction to the virus.
All right, I want to show this video real fast. This, interestingly, somebody sent me this a few weeks ago. This is Dr. I think she pronounces her name, it's Leanna Wen. It could be Lena, but I'm going to guess it's Leanna Wen. And she was on Chris Cuomo's show, which is funny because I made a joke at the beginning how I'm interviewing my family member like he interviewed his brother for so long. But anyway, again, reasoning being, Dad, I really appreciate your willing to come on short notice, very early in the morning. It's very hard to find a doctor on such short notice who jump on YouTube. But I wanted to show this because it has been deleted from CNN's YouTube page. I can show everybody that in a second. I went to go find it so I could download it for our talk, and it's gone. It says that it's been removed by the user. So obviously CNN took this down. Maybe they got a lot of negative comments about it. I'm sure people can see why in a second when I play it, but you're going to essentially see her say, we really need to push vaccination related to the lockdowns, because if states just start opening up and people have their freedom back again, then they may question whether to get the vaccine. And I found it very interesting, and I'm just curious. I'd like to hear your opinion as a medical professional about, her thoughts on that. So let me just play it for everybody real fast if I can get this thing to work here.
Many more people, millions of people who,
can you hear
for
it
whatever reason, have concerns about the vaccine.
I can.
You can?
CNN.
Whoops.
Yes,
so
and I've listened to it
the
before.
CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things. Here are all these freedoms that you have. Because otherwise, people are going to go out and enjoy these freedoms anyway. Okay.
And there's Del Bigtree. He's eating a carrot. He's the only one I could find that still had this up. So he was smart enough to save it. But anyway, I'm curious, because I think for me, it was, the person who sent it to me was kind of shocking, because he said, I didn't know they were going to just be so obvious about linking these two, like health policy and essentially basic freedoms. And, I've been really clear on my channel that I don't want to push one or another, because I think this is something that everybody has to make a choice. Everyone who makes a health decision, especially one that could have longstanding consequences, really needs to do that with their own healthcare providers and their own decision making and the research that they've done, and feel good about it. And feel like I'm making the right decision for me. And I think the reason I keep talking about this and come back to it is because, knowing quite a few people in my industry, and I don't know about yours, but I'm guessing there are a lot of people in my industry that think you're really just nuts if you are even questioning this. Not only are you like an anti-vaxxer, that's the label often put on people, you're anti-science, you're not an American, you want all these people to die. And so it's curious to me that we have this novel virus and a brand new vaccine that's not approved. It's authorized, right? And I was a new thing for me. I recently learned that there's a difference between authorization and approval. What's up with that? I guess, what are you seeing in your field? Are doctors feeling peer pressure to not ask questions about this in the same way I think, journalists are actually too, peer pressured by their own friends that I had a friend last night who told me she wouldn't date anyone who doesn't get the vaccine. So it was shocking. She's still single, but I'm just curious, what do you think about all that?
Well, I've been doing vaccines in the vaccine clinic. I was reassigned to vaccine clinic 2 months ago. I've been doing vaccines about 50 a day. So I've interacted with people. And one of the first things I say before the vaccine is, do you have any questions about this vaccine or any questions about the side effects? And there are many people who say, no, I don't have any questions. I'm just glad to get this over with so that I can get back to my normal life. And then I say to them, oh, what's your normal life look like? And they'll say, well, I want to go back to the gym without a mask. I want to go to the baseball stadium, on and on. And I'll say, well, how does the vaccine get you to do that? Well, I have my passport now, and there's so much pressure, and I just want to make sure that I can get back to my, they're all talking about freedom, and very, very, very few say, oh, I'm doing this so that I don't die from COVID. In fact, I don't think I've heard one. So this freedom versus control issue is to me a very big one for people. And to me, this video really comes out and explains what's really going on. I question whether the federal government has our best interests in mind if they never talk about strengthening my innate immune system, but they constantly talk about getting an unproven, unapproved vaccine. This was an emergency use authorization. Nobody knows the long-term side effects more than 5 weeks after. We're starting to see blood clots and things like that appear now that we're 3 months or so out. But nobody knows the long-term effects. And many have been speculated. So the reason to me is they're taking away my freedom, or trying to. I love the pushback. The Texas Rangers had a full stadium. Governors have said there will be no vaccine passport. I know in Florida, and I believe maybe Alabama or Arkansas. So there's definitely pushback against this attempt to take away our freedom to quote unquote get back to normal life. So I think this video is spot on. I'm glad Del Bigtree was able to keep it. I'm not surprised that CNN took it off. Freedom to me is the United States. That's how this country was founded, and I would like to keep it.
I brought in my buddy Eric Hunley, who we do a live stream News with Booze every Wednesday, but we're going to just do News with Coffee, I guess, right now, unless you want to start. I guess you guys, yeah, it's a little later in the day for you, so you could probably have booze, but people would look at me weird if I did at 8:30. So, Dad, if you do you have anything else you'd like to say? I know you might have to run soon, but I am showing people how the video was taken down. This was the original link to that video when CNN had it up. Any thoughts that you'd like to share? Or Eric, you were listening for the last bit. Any questions you think would be good for him to answer before he goes?
I have a couple of questions. One, from what I understand, the vaccines are not proven to stop the spread. So there's no reason people wouldn't still be wearing the mask. Am I incorrect on that?
Yes. The emergency use authorization document specifically says it is not proven to prevent spread of the virus. And the immunologists that I've listened to have all said that this lowers your symptoms if you get the virus. The vaccine in no way prevents spread of the virus or prevents you from getting. So to me, if you get the vaccine and then you go visit your grandmother, you're probably more likely to spread it because she won't know if you're sick.
Right. So where's your freedom?
So it increases the risk of spread of the virus from what I can see.
That's what I thought. I guess that's my question is, where is your freedom then? People are like, oh, I'm going to take it and it's going to make me free. Well, no. And could it not make things worse? Like you just said, you'll visit grandma saying, oh, good, I'm all green, all clear. I can just do anything I want and then technically go be a super spreader. I think he's frozen.
Yes, the audio is really soft, but absolutely. People don't understand what the vaccine does and what it doesn't do. And they don't want to hear it in my vaccine clinic when I offer it to them. When I say, would you like to know what this vaccine does and what it doesn't do? It will lower your symptoms. And there's a difference between the virus, which is SARS-CoV-2, and COVID-19, which is the disease. And the virus lowers the symptoms of the disease. Short term. Mm-hmm. We don't know long term. Long term, it might have very deleterious effects on our innate immune system. Since I'm about to run out of battery and I don't hear people very well, I just would like to make one other point before I leave. And that is, everyone, if you're getting stressed out over these blood clots, if you're getting stressed out over whether or not you should have a vaccine, your innate immune system is being compromised by the stress. Every time you have an emotional reaction of anger or fear, your gut biome, your gut bacteria will retreat, and your immune system will not be as protected. So look at yourself. If you're getting stressed out over anything, turn it off. It's going to make you more likely to die of COVID. If your innate immune system, which takes care of things without viruses, without any reaction, you don't even know it, non-specific IgM, T cells, etc. If your innate immune system is working well, functioning well, if you're not stressed out and you're eating properly, getting sleep, you're not going to die from COVID. It's your adaptive immune system that's killing people. And the adaptive immune system is triggered. It's turned on more by these vaccines. So I think long term, there is going to be a problem. In fact, it's already been shown, and the immunologist whose name I sent to Allison from Yardley, PA, he says that the reason that people are getting severe COVID when they get a vaccine is because they had seen the virus before, and they had virus on their cells when they got the vaccine. And he's trying to spread the word that it's absolutely essential that you not get these vaccines if you've had the COVID virus, or you've tested positive, or for the antibodies or the antigen at any time in the past, because those are the people that are likely to severely overreact. So strengthen your innate immune system by dealing with stress, diet, your emotional reaction, deal with that, and don't overreact, and do things like I did. I told my wife one day 3 months ago, or maybe 6, we're turning off our TV cable subscription. We no longer have television, because she was watching Fox News and CNN and on, and she was getting stressed out. And I said, it's just not worth that. And so now we're saving about $100 a month, and she has much less stress. Anyway, that sums it up. I really enjoyed it. Anything else I can say other than goodbye?
Well, I mean, I don't know when you're going to lose your signal because your phone's going to die. I think it's funny that you and Mom don't watch my old industry anymore. But as I used to say, I just make it. I don't watch it. So I rarely watched it either. So anyway,
Good.
But I'm curious. Somebody
Drug
did
dealers
ask
don't
that,
sample
you know,
their own product.
they got the vaccine and now they're really scared. And I think maybe it goes to the point we just made, but you know, I guess just any thoughts for someone, are there symptoms that say they notice they should go see their doctor if they do feel like maybe they're having a reaction? I guess maybe that would be helpful for people.
First thing is, your risk from the vaccine of getting a blood clot is very small. Your real risk is if you contact COVID in the future. So obviously, if you don't feel right, if you have symptoms more than 3 days after your vaccine, you definitely want to contact your primary care provider and make an appointment and go see them if you're concerned. However, the risk here is not blood clots. That's 1 in 358,000. You have a much less risk if you go skydiving of dying. So if you would go skydiving, I wouldn't be too concerned about the blood clot, but I would pay much attention to your innate immune system and how to strengthen it so that you don't overreact when the innate immune system is not working well. Then you will use your adaptive immune system, and that's inflammatory, and that's what causes disease. Always remember this fact, that disease is your overreaction through inflammation. It is not the virus. The disease is COVID. The virus is SARS-CoV-2. If you have a well-functioning innate immune system, you won't have any symptoms. The virus will enter your body. Your innate immune system will take care of it without your even knowing it, and you'll just go on about your life.
Flynn asks, what may be the
I
long-term
went around
effects?
too much. Vaccine, the concerns, I've already had the vaccine. It's water under the bridge. Don't worry about it. But don't think you can visit your grandmom and she'll be safe.
Yeah, like Dr. Fauci told all the kids at Christmas that Santa can come to your house now because he's been vaccinated, which I said was straight propaganda. Real fast, Flynn asks, what may be the long-term effects of the vaccine on the adaptive immune system if the doctor can make an educated guess? And then, I know you don't want to give medical advice, but like Christian asks, I have been complimenting taking the vaccine, but had COVID in January. I recovered after a week. Should I just take vitamin D and other supplements rather than take a vaccine? I'm guessing you don't want to necessarily tell people they should or shouldn't, but those are two quick questions to throw at you. Long-term effects of the vaccine on adaptive immune system, and like if somebody already had COVID, thoughts on getting the vaccine.
Yeah, immune enhancement from getting the vaccine is the long-term suspected effect, because this vaccine is different from all others. And I think that's a real concern, but it's not proven. So that is a reason it's a reason to wait and see. It's not a reason not to get the vaccine, but it's certainly a reason to wait and see what happens a little bit longer before getting it. This probably will be a yearly thing. So it's not like if you don't get it now, you'll never get it. The second question was, repeat it again for me.
Long-term effects on the immune system.
Yeah, that was the long-term. So your adaptive immune system will be likely long-term, will likely react more to
COVID. Okay.
The vaccine has a direct effect, apparently, on the innate immune system. And so if your innate immune system is suppressed, and that seems to be how this vaccine is detrimental to the immune system. If your innate immune system is suppressed, then your reactive or adaptive immune system will take over. And that's when you get more inflammation, more disease, and more chance of death. So the vaccine potentially has serious long-term effects. And that's why I'm in a wait and see pattern. I have not received the vaccine yet.
Okay. I had one last question before you run out, and that was just, is it possible that we are achieving herd immunity anyway at this point due to the number of people who have already had the virus and things like that, and the vaccine's being rushed out almost simultaneously and maybe taking credit for the thing that is already occurring?
That goes back to that video from CNN, for sure. If we were to get herd immunity, then they wouldn't need the vaccine. And so that scares
a lot
them.
of money.
If you look at
Haiti
and their experience, they've had a very good experience. They reached herd immunity. They never took the vaccine, and they're doing just fine. So I think absolutely the rush for the vaccine was, we got to do this before herd immunity, because if people gain herd immunity, which is the young people go out, get the disease, recover from it, very few die. The older people stay inside because they're at risk. We reach herd immunity, and then the older people come out of their house, just like it always used to be for generation after generation. Then, we would reach herd immunity. And for sure, the vaccine does not give us herd immunity at all.
But they'll claim it. I bet you.
Okay. Well, my battery's almost out. Thank you so much. I'll charge it up a little better next time.
All right. Bye. Thanks.
Thank
you. You're welcome. Bye.
See ya. Well, Eric, thanks for jumping in. Interesting. Sure. I wonder how long this video is going to be up on YouTube.
I don't know. Test it. Change the title.
Yeah, exactly. Well, it's one of those things where you can fly under the cover of mainstream media, because if they're reporting on it, then YouTube's less likely to pull you off. So now that they're talking about it, it's probably less likely. But it's the thing that sucks, because there are people who have been talking about these issues for a long time. And then it has to get to this point until, YouTube will say, okay, well, we'll let those videos up. Like with the ventilators, there were people that were getting silenced for questioning the ventilators until it was causing such a significant problem. Then all of a sudden, you can start talking about ventilators not working. Whereas like for me, I would have liked to have known if I was facing the possibility that my doctor was like, we could put you on a ventilator. Like, you know what? Why don't we try this instead? I don't know. It was just weird to me at the beginning of yeah, go ahead.
I was gonna say, yeah, let's try a CPAP machine instead or whatever.
Yeah, but it's like you don't get to even know that there are other options out there until until corporate media reports on it, and they're reporting on it basically when it's gotten to the point where it's no longer conspiracy. It's so it's gotten to the point where now it's like, okay, now the government is finally taking action, whatever it is. So I'm sure that he said a lot of things that a lot of doctors would say, what is that guy doing? But, I thought it was important to just show people that there are other medical doctors out there who are questioning this. They're not like Trump's doctor, they're like,
as soon as they question it.
Yeah, but it gets labeled that way. And I'm sure I would, you see it in every industry now, right? We're seeing it with judges. We're seeing it with journalists. We're seeing it with politicians. We're seeing it with doctors. We're seeing, and I'm sure there's nothing new about it. I think what's new to me now is just how obvious it's starting to become. Like somebody said yesterday about my Brian Stelter video. This surprises you? I can't believe this surprises you that they would say you should start posting your medical information publicly about, your vaccine selfie. And I'm like, it doesn't surprise me that there's propaganda or that there's a push for whatever it is that corporate media wants as a result. It's just how obvious it is. It makes me wonder because the first layer is like, okay, they're just, they're just too stupid to realize how blatant they're being. But then there's like the more sinister side of me that's like, is that part of the plan? So I don't really know what to make of it. And I think I was just interested in what he had to say, because I know doctors are feeling a lot of pressure right now to be a team player in the same way that journalists are. And if you're a doctor who comes out and even lets people make decisions where they're questioning this and saying like, no, I just, I'd rather, it's just like, I feel like there's a lot of pressure to tell people, come on, so just get on board. It's so minimal. And you know what, even if it is minimal, it still should be your right to choose, right? I mean, it should be my right to choose if I don't want to drive a vehicle, even though getting in a car crash, I just feel like it should be your choice. So I don't know, curious what you think.
Well, I can make it really simple. If you want me to feel confident to take a vaccine tomorrow, put the liability back on the manufacturers and the pharmaceutical companies. Get rid of the vaccine court. And if I know that Johnson & Johnson and the other companies have liability to the vaccines and they can be sued, I will be 100 times more comfortable to take a vaccine tomorrow.
Right.
Right now, you have a situation where not only do they not have a liability, the taxpayer is going to cover them if anything does come up, and they don't have to acknowledge it, but they also have the ability to print money. This literally is printing money for them. And I had to ask the question about the herd immunity because I really do question the timing. We've got to get everybody vaccinated now. Well, I think we're headed towards herd immunity as well. Now, simply because we're running into summer, spring, things like that. So it could be weather, it could be a downplay for the virus. But there are a lot of incentives for some people to say, everybody get vaccinated. And since many people have been vaccinated, they're already taking credit for any kind of herd immunity that's happening. And doesn't that work great? It'd be like, oh boy, we dodged that bullet. Thank goodness we shoved the vaccine down on everybody. And look what we've done. We've solved it. Oh, by the way, don't forget your vaccine shot in November. You got to take it every year now so we can print more money. I don't know if that's, I'm a little cynical and jaded. I'm not trying to put on a tinfoil hat, but like I said, put the liability back on them and I will feel a lot more comfortable.
Yeah. I mean, I just think that's a fair point. It's a fair point to bring up in something that some people don't know. They don't know that there's a vaccine injury court. that these things exist. And you can argue all day long, whatever you want about, yeah, but it's rare, it's this or that, but just acknowledge that exist. I think that's what bothers me the most, as with any conversation, and the ones that I typically focus on my channel, is the narratives that don't allow for the nuances of whatever it is that you're discussing. And, you know, a couple of the big nuances here are that, that the liability issue is a real problem for some people. And let's talk about that. Why is that? In fact, I just saw a tweet yesterday that said, people that say that you don't get 100% immunity with the COVID vaccines are wrong. You do get 100% immunity if you are the company that's making them. Which I thought was pretty good.
You got to make it shorter, though. That's the problem. Even that nice joke is too long to fit in a headline. It's too long for a bumper sticker, so that message can't get out there.
I did want to answer this question real fast. Is there a backup place to watch this if YouTube cuts it? Yeah, I'm on Odyssey, so this should be streaming, simulcasting on Odyssey right now. Here's something, people are asking about the polio vaccine. So I wanted to, just show people this, if it'll work here. Oh, hang on.
If I recall, they had liability with the polio vaccine.
Yeah, I'm trying to find the comment that I highlighted so that I can, okay, here we go. So I can take that off. Well, yeah, but there was also, a lot of talk about the effect of just like cleaning up water systems and whatnot in the United States and the effect that had on it. So this is Rotary Club from 2019. How can clean water help eradicate polio? And basically say that projects focus on water and sanitation as an important part of the fight against polio. And so, not to say that, I'm not a vaccine expert by any means. And so not to say that the polio vaccine didn't do great things. I honestly just don't know one way or the other, but I do think a lot of people don't realize that it also kind of came at the same time where we cleaned up, our living standards and sanitation standards and whatnot. And so that probably helped too. But I just, and there are changes over time with how vaccines are developed. Just like, Coca-Cola used to be made with sugar and now it's made with high fructose corn syrup. What are the differences? And,
and I had cocaine, Allison. Cocaine.
Back in the good old days.
I know. That's the one I want. Can I have some of that, please?
Right. Exactly. Yeah. So it's just, it's important to know that like there could be changes over time where you could have had vaccines that were developed differently and so maybe didn't have the same problems. I don't know. I just think anyone who says that, you don't trust science by having conversations about this is just, it bothers me. Are they just don't realize that this stuff's happening because they haven't seen it, or they just think the problem's so small that what's the deal? But I'm sure you've heard that before. I get it a lot of times when I do these videos. Like, why don't people trust the science? It doesn't feel like people aren't trusting the science by asking these questions. It feels like there is plenty of science out there. And
have you heard of phrenology?
Are asking questions.
Have you heard of phrenology? Have you heard of eugenics? Those are science.
Oh God, you're going to get me really.
So technically, trust the science. Well, okay, which science? And science itself is meant to burn itself down. So science of today may be garbage tomorrow. The nuance. Again, everything is nuance. Right? And an example is the whole COVID thing, right? Instead of only seeing the vaccine, which we do love silver bullets, that's an American thing especially, I haven't gotten much guidance to lose weight, and I probably should. If I lose weight, I am far less likely to get COVID because of all the comorbidities. Probably could get rid of a lot of people in a borderline of diabetes, another comorbidity. So why aren't they pushing that? Why aren't they pushing a healthy diet? Why aren't they pushing getting outside, getting more vitamin D? Why aren't they pushing 1,000 other factors that, by the way, are free? Oh,
yeah.
Did I answer my own question? Oh, okay.
That's the problem. Well, story I've told you before. When I was bringing up that exact question during flu season, because every year all the TV stations have the local health department on and talk about get your flu vaccine, which can be anywhere between like 15 and 40% effective. but
If they
we
pick the right
rarely talk
strain.
about like getting enough sleep, vitamin D, being outside in the sunshine,
Mhm.
all that stuff. Yeah, like you said, healthy cardiovascular system, healthy diet, probiotics, good gut microbiome, immune system that reacts because of that. Like, I don't even think I heard microbiome hardly ever when I was in. And so when I even brought that up, I was told to F off by my manager. So,
I believe it. I believe
and,
it.
and,
We don't
you know,
need that.
same manager. So I'm not saying this is everybody, but you know, it is, I would say, a prevalent, understanding among people, and at least in TV news. There was a conference held with doctors who had come in to talk about how Washington was going to be passing this new legislation to take away your, you know, philosophical opt out on your kid going to school unvaccinated, basically. And so there were some doctors that came into this conference to talk about why, you know, issues that kids can have, reactions to vaccines and whatnot, and why this discussion should be had about, you know, why, in other words, the pushback, I guess, to that legislation, removing the health choice or the philosophical choice for parents on this. And I suggested, because we'd been covering that issue of, you know, and I think at the same time, like measles or mumps or something was on the rise. And so, you know, there was all this focus on it. And typically we just interview a mom who was, you know, outside, and this is my freedom, this is my choice, which is fine. There's nothing wrong with having that person on. But to me, it would be far more helpful to interview health professionals who have divergent viewpoints on the topic and have them, you know, talk with each other and have that conversation, so you can hear the different sides of the healthcare providers, not just the moms and dads who feel like their freedoms are taken away. And when I pitched that this conference was happening and this would be another option for us to cover, because we had been already covering it. So I was like, this might be a better option for coverage than just the moms and dads outside the courthouses or outside of the Capitol. I was told, you're never allowed to pitch a story about vaccines ever again. You have to come directly to me. So I'm not allowed to tell the assignment desk, even, here's an idea. I was told I was not even allowed to pitch ideas to people about it. Listen, I didn't determine coverage. I wasn't saying you have to go do this, right? I was just saying, hey, here's an idea. Like, I was told I was not allowed to do that anymore. I had to go straight to the manager.
Well, Allison, I learned that the proper technique to pushing a narrative. For example, I was a strong proponent in gun control when I was a teenager in the 80s, and I learned that the methodology was, you find a Harvard professor with statistics to say that it's bad, gun equals bad. And to be fair, you got to get both sides. So you find the worst looking, raggedy looking, gun toting individual. I'm not trying to slur any names or pictures, but everybody can picture it, who says, you can't touch my gun or I will shoot you. And then you say, that's the other side.
Right. Mm-hmm.
So, oh yeah, that, you know, that's some fair coverage. So I'm sure that when you're out asking the mother or whatever, saying, hey, it's my right, whatever, the more outside of the norm she might appear, probably the better a candidate she would be to interview.
Well,
in theory.
Yeah. I mean, I guess.
There you go, Ted Nugent.
Well, yeah. Well, let me ask you this. What do you think is the fear on the part of the manager who says, no, you cannot interview the professional healthcare provider about their thoughts? Because he likened it to a scientist who would push back on climate change, which there is a
But we don't
variety
even
of
acknowledge
ideas.
that. We just, well, yeah, it's cognitive dissonance to the extreme. It's like the old doctor who smoked. Okay. You're telling all your patients to quit smoking, but you're out in Mac having a cigarette.
Right.
And if I told you about it, you say, my grandfather lived to be 110.
Yep.
And drinking martini every day. It's a very, very similar principle. You have your mind made up. We're all guilty of it. And that, I really feel, is what's going on there. It's like, no, I am not going to. They look respectable. We know that they're snake oil salesmen in suits. They're snakes in suits. And we don't even acknowledge them because, you know what? They look like they're legitimate, and that can fool people. But we know deep down in our heart, their message is bad. and it should not be put out there because
Should not be put out
it's
there.
not even acknowledgeable. It's not even worth part of the conversation.
But it
Has to be.
drives that ignorance on the side of the public that just thinks, again, I say this all the time, just because you don't see it out there doesn't mean it's not there, right? Just because the idea has not crossed your computer screen doesn't mean it's not there, because there's active suppression of information. And that was, I feel like that was an active suppression of information when my boss told me that we couldn't do that. And it also just, so it makes you think when you, all you see on TV or all you read in the newspaper is crying mom versus doctor. So, or crying dad who's like, this is my right, versus doctor who says you're crazy because you're totally fine. That's not a fair, to me, that's not a fair fight. That's not a fair fight. That's an apples to orange thing. You need to have another healthcare provider, and they don't show that. So then everyone thinks that it's a science versus anti-science, or it's a Jenny McCarthy follower
in
versus
the same
doctor.
sentence. No, they always say it in the same sentence. They're a blah, 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 and don't trust the science. And by the way, have you read the Milgram experiment? You should. That is one of the most important experiments. Doctor, his parents both, I believe, were killed in the Holocaust, or at least relatives were killed. And he went to explore the whole thing of, I was ordered to do it. So the Milgram experiment is literally where you have somebody in a white coat, the doctor, and there is a white coat bias known out there, and it's all in the Milgram experiment, bringing people in, and there were two parts. There was the actor behind the screen, and then you had student and teachers, how they were broken down. So the student would have to answer questions, and the teacher, to help encourage them, would give them a little shock every time they got it wrong. And the shock level kept increasing. And the student was actually an actor on the other side of the wall. But they would, over time, as the shock level kept increasing, it would be like, oh my God, my heart. And they essentially, I think it's about 60% killed the person behind the wall. That is how strong the authority bias is. It is an extreme bias. If you ever read Cialdini or things like that, white coat syndrome is huge, and it is really locked in. There's other ones too, like will you go cross the street if somebody is wearing a sloppy t-shirt and jeans and jaywalking? No, but if somebody in a suit does it, people will follow. And they've done experiment after experiment after experiment. And this falls into the whole appeal to authority or authority bias. And I think that's what is going on there. You get a white coat to tell you, and are you going to argue with that? That's the authority that they know it all.
Well, and so cabin fever says, talk to a doctor about medical stuff. Don't rely on YouTube videos or YouTube chat. But to your point, what doctor? I mean, all doctors are not created equal. All doctors do not think the same way. And so it's very important for people, whether we're talking about COVID, the COVID vaccines, or some other issue that you're having. I have had, like, even with our dog, I was researching other doctors, especially when it comes to a chronic problem, something that's not acute battlefield injury, if you will. I think my dad would be the first person to say, as an orthopedic surgeon, that they're trained very well in medical school and residency to deal with battlefield wounds. In other words, you have an acute trauma of some kind, and like, this is what you do with it, especially if it's some kind of pharmaceutical response, or like, he puts you in a cast for your broken arm. What they're not trained very well on is long-term chronic problems. How does your gut bacteria affect your immune system? How does your mind-body connection, your cortisol and adrenaline and all these neurotransmitters and hormones and whatnot, and how that affects your body, and stress responses and things like that. And that's why, like, I look for different doctors. I get second and third opinions all the time, because I'm highly aware that same way that you would look up different news sources, there different news sources are going to tell you different things. And I think it's really important. That's why I really like Ryan Christian on The Last American Vagabonds note that he puts on all of his stuff, which is, don't trust me, go do the research. And I think that's really fair thing to say.
Absolutely.
So I just leave people with that. I think it's like, don't just assume that you saw. I played that video of Dr. Wen on CNN, and okay, well, she's got one opinion. She's a doctor. She's allowed to have her thoughts on how we need to get people vaccinated before we give them freedom. She's allowed to have that thought, and there are a lot of doctors out there. And if you want to have a doctor that has that outlook on things, that's your choice, right? Go find her, or any one in the number of others of them out there. But maybe you also want to get a second opinion, go do it. Because I feel like 2020 was my mind opening to the idea that all these things, and I think it's really stupid on my part that it took to almost 40 years of age to get to this point, where I started realizing that like all of these institutions that I had thought, somehow there was this unanimous or objective way of pursuing whatever the practice is, that there actually is a significant breakdown in the differences in ways, whether you're like in the court systems, whether it was the election, whether it was COVID, whether it was Black Lives Matter, like whatever it is, there's significant variety of thought that I realized, wow, that was part of my understanding of my industry. Was now I can see why the public is the way it is, because we're not really giving them the variety and the nuance that's out there. And so of course they all look at each other like, if you could think this, you're obviously not on my side. You must be crazy. You must be all these things, because I'm just not exposed to it. And so I know that sounds really elementary.
It's Gell-Mann syndrome. I mean, Gell-Mann syndrome the whole way. And people don't realize it. We all fall victim to it. We are an expert in one thing, and we read about it in the press or the paper, and we go, well, that's wrong. That's not right. But we don't have the ability to look beyond it and say, well, if what they said about what we do or our profession is wrong, then it stands to reason that it's wrong about many other things. We just, again, assume that it is right. There's a long history of reportage that has been, quote, respected, but that doesn't always hold up. I mean, yellow journalism came about before they closed down the competing papers in town. And then they said, okay, well, we're going to be neutral because there's only one paper in town now, and we have to tell both sides, blah, blah, blah. But the press has always been polarized.
There's a lot of chat about here we go. Here's a good one maybe to show. You don't trust authoritative sources just because they are the authority. That doesn't mean you should do away with all experts in general.
I agree.
And yeah, people going back and forth. Right. It's easy to just say like doctors don't know anything, or mainstream media sucks, journalists are terrible, whatever. And so, and I do think you don't go by brand. I think you have to go by individual with a lot of this stuff. But I do think it's a fair point. Like, yeah, I mean, there are a lot of doctors who are waking up and trying to think through some of this stuff, and really just like me, didn't start from a place of malfeasance or intentional malfeasance. It was a place of ignorance. Like they just weren't aware. And then one day, just like the light bulb goes off in your head for whatever reason, and you start down the rabbit hole. And it takes a while, I think, to unlearn and then relearn. So it's like, it's not just an immediate process. You wake up the next day, you're aware of what you don't know, all of it, and now you immediately have the new knowledge. It takes a long time. So people are people. That's why it's just important. And I know people get frustrated with this, but the responsibility is on us. The responsibility is on us ultimately to make sure that we're doing the research. I don't love that. I'll be honest with you.
Though. It is very difficult.
It is.
No, I don't blame people who work, 12-hour days, 60 hours a week.
Sure.
They just want to go and read something and be done and get a general idea.
Right.
And that, I think is completely unfair. And as a last point, there is an experiment done. You know how you've always heard 3 out of 4 dentists recommend this toothpaste, right?
Right.
One methodology to collect that information in marketing is they will go to all the dentists out there and they will give them a list of 5 toothpastes, and they'll say, check off which toothpastes are okay to use. And so then they'll check off Crest, Colgate, blah, 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 blah. And so then you get all the survey back in and you say, well, 4 out of 5. Now, they didn't say they recommended over everything else. They just said, yeah, it's okay. So you got to watch that stuff. And every message out there could be true or not. You have to parse it. There's a 1,000 ways to look at it. And it'll make you a little bit cynical sometimes. But
totally. And I feel for people. It is frustrating. I'm saying that it should be just us, the public, that has the onus of responsibility. Because when I go see our pediatrician, I just brace for the conversations I'm going to have, because there are a lot of things she just doesn't know. And I have to hand her the studies, and she always tells me like, oh, I don't have time to read this. Well, I do, you're the doctor.
Wow.
So,
I mean, it's in your field.
Yeah, it shouldn't be my responsibility, but what should or shouldn't be versus what is, we have to be realistic about. And, to go to your point about the toothpaste, for instance, like I won't speak for Lynn, but I don't use fluoride toothpaste. And there's, there are a lot of doctors who and our pediatrician, she wanted us brushing our daughter's teeth with fluoride toothpaste when she didn't even have teeth. Just brush her gums with it. And I just asked a simple question about gut bacteria and the effect of it on gut bacteria. And she really didn't have a whole lot of an answer to that, because she just was starting a book on the microbiome. So she's very beginning of that. So then she said, but, studies have shown that in areas where there's fluoride in the water, kids have a lower rate of cavities. And I said, okay, but here's my pushback to that. Where's the study that looks at a kid who has a healthy diet versus a kid who has the average American kid's diet, and then extrapolates data, and the results using that? Because all we're looking at is a bunch of really unhealthy kids. And I look at fluoride kind of like a crutch. If you don't have good mouth and gut bacteria, you've got an imbalance of that, and your diet's terrible, it would be like, all right, yeah, you're limping around in life, and so here's a crutch. But the ideal would be that you wouldn't need that at all. The ideal would be that you would be taking care of your gut and mouth bacteria, and fluoride is hurting that. And so, you wouldn't do that. But she was like, well, I've never had anybody ask me that before. I've never had anybody say there's a different, these studies can all be done a certain way that, gets you to what you're looking at. And just because, one layer of it shows something doesn't mean that if you start asking questions. Vaccines are another great example. Most people don't realize there really aren't a lot of vaccine studies that have looked at a totally unvaccinated population versus a vaccinated population or whatever, because that just isn't done. So to discount that there could be side effects that kids are dealing with, allergic issues, asthma, whatever else, you can't really say for sure, because it's not something that's been done extensively, looking at these two populations and understanding how vaccines may be affecting long-term health, especially in children. So it's just important for people, I think, to be aware of that. What do you say, Eric?
I agree. I agree completely. And I actually have to jump off on another call. I think that you may too. I don't remember.
Yeah, I probably need to go too. Okay, well, just making sure that we got through all these guys. I appreciate your taking the time to do this, and
of course.
We'll see how long this stays up on YouTube.
There's the fun part. It's not monetized, so they won't look as quickly.
Yeah, actually, that's a really good point. It is. I should say that at the very end of this. I should have said this earlier. It is Anti-Authoritarianism April. So there are links in the description for how you can support my work. And I guess we'll see you guys next time.
See ya.